Alrighty, Kit, the floor is yours.
Hey, okay. Well, hi everybody. Thanks for coming. Uh, Billy Joe, Aiden, Petra, Sarah, um, and Yvonne. So ECHO, as you all probably know, is all about transportation to essential, services like medical appointments and other things like groceries and prescriptions. And also we have another half of our business, which is equipment lending. So we have kind of an equipment library that I'm starting to try to get online, and I'll talk a little bit about the changes that we've been making at ECHO in the last year. Um, and yeah, we are a tiny little organization, but we've been in business for almost 30 years. And the current board that is there, many of them have been there. And in fact, I think we just lost one of our original board members. So they just hang on and do hard work and participate. And they've been doing it for, like, some of them 15, 20, 30 years. So we have a very active and involved board, which is absolutely fantastic. And we couldn't do it. I couldn't do it without them. Hey, there's Brett Black. Anyway, one of the most important things I can tell you, how you doing, Brett? One of the most important things I can tell you about ECHO is that we're looking to survive another 30 years. And so in order to do that, we're kind of trying to push our little organization that has been very, very casual, very gosh, we've had a lot of volunteer help. We've had free rent basically from the Presbyterian Church for almost 30 years. They've housed us. We were born out of the congregation at the Presbyterian Church. They were the ones that started this whole thing, and they did it by hook or by crook. They just figured it out and figured out a way to get people to appointments in their congregation. And then that grew from people in their congregation to people outside of the congregation, and then everybody in the community, and then everybody in Fort Townsend, everybody in East Jefferson County. So all the way to Brennan. And of course, we go out to as far as Gardner to pick people up. And so, yeah, it's been a very long history of very casual, but very hands-on kind of management, that the board was able to do. At this point, they've hired me last December to kind of keep things going. And the way I decided to do that was to start investing in some changes that I thought would bring us further toward the future. For instance, I knew we kind of needed to move because the Presbyterian Church had been asking us for some time to find other digs, but there hadn't been a lot of bandwidth in the staff to go do that. So I went and found something that was just a very inexpensive commercial rental. I found something that was half the price of most commercial rentals, and I moved us down there. And was talking to a group of people yesterday and realized that, there were some choice words said when I finally realized all that equipment was going in that one little space. But it was a wonderful move because the parking lot is zero clearance to the entry. And so our people can come into the building so much more easily. Up on Jefferson Street, we had this really large ramp that was great. Actually, I think it was built by the Boeing Bluebills, but a lot of our clients were so elderly and disabled that they couldn't get up the ramp very well. So honestly, it's a better fit for us to be in a zero clearance kind of a situation. Um, but that also presented a financial challenge, of course, which we met by cutting our staff in half. Well, cutting our only full-time employee hours and cutting our open hours down from 8 hours a day to 4 hours a day, which was a big, big choice for us to make after being open for a long time, 8 hours a day. So, what else can I tell you? A few statistics I can throw at you. Um, we drive somewhere between 50 and 60,000 miles a year. That is the current statistic, and that's a lot of miles. And our volunteer, we have 46 volunteer drivers, and of those 46, about 25 are active at one time, or every month there's about 25 unique drivers that work. Um, and they do kind of, whatever amount of miles they want to do, and whenever they want to pick somebody up or not, it's all according to their ability to meet that need. And um, they get to choose their hours and days and rides. So it makes it super attractive for the volunteer. They're not committed to any particular schedule. And often we find that they become so attached to their riders that they're taking to different appointments that they start showing up a lot. And we have some drivers that drive just, like so many miles per month. It's amazing. They kind of blow the curve for everybody else. Um, we hand out hundreds of pieces of equipment every month. I'm going to say somewhere around 250 pieces of equipment every month to different people in Port Townsend. And we just started a closet down at Quilcene, and the Quilcene Fire Department Cares team has volunteered to transport that equipment. And then OLICAP has volunteered to house it and administrate that sharing. So Quilcene Community Center now has a cares closet, basically. And we're also getting our Port Ludlow Cares Closet back together. We had one at one time, but we lost our volunteers. So Brett actually got us some new volunteers for the Port Ludlow Cares Closet. And we hope to get that up and running really soon, because that's such a need down there. And there's just a long drive to go get a walker if you're living in Port Ludlow. So, what else can I tell you? Oh, so that the first change was to go find another location. The next change was, of course, to get that scheduled and handled and cut our staff, our full-time staff member down in hours and close our doors for half the day. Another change was to invest in some software that I'm really excited about. It's equipment lending software with MyTurn. And lending libraries like tool libraries use this lending software all the time, all over the country, to really good effect. And I'm excited about getting that online this winter. We're already loading it every month with everybody who borrows and brings back equipment and their names and email addresses. We're starting to capture all these statistics and metrics, and that software is being able to help us analyze what to provide, when to provide it, how much to have on hand. And those are incredibly important statistics for us. Because the consolidation and kind of streamlining of our organization is something that was very important to me strategically in order to go into the next 30 years. You can't be very loosey-goosey if you're gonna survive the coming financial shortfalls that we might all be facing. So another change, let's see.
I have a question for you, Kit.
Yeah, sorry.
So
Yes.
I'm curious if you could elaborate. This is me, like I'm curious about lots of programs in your county. So I'm curious if you could elaborate when you talk about equipment, like what does that mean?
That is, walkers, commodes, toilet risers, wheelchairs, crutches, um, many different kinds of specialized equipment for people, knee scooters, things that help people recover from all kinds of surgeries, all kinds of injuries. Um, so, yeah, it's all durable medical equipment. And we try to keep on hand things that are in really good shape, that are clean and in good repair. We just hired in August a equipment coordinator who has owned a bike shop for 30 years. And so we're just blessed to have him, because, wow, he's closing his bike shop and turning to ECHHO. He told me one day, this is easier, lighter weight, and cleaner, and I like it better. I was like, great, I'm so glad you're here. So he creates order out of a lot of chaos in that little room. And I'm hoping to expand equipment again eventually. Yeah, I would love to expand back out in terms of both hours and space. I just don't know, when we're going to be able to do that. At this point, I'm still sort of consolidating, and I even have, a austerity plan in the works in case we have to cut more something. Yeah, fingers crossed we don't have to. But but having a plan makes me feel better. Having a plan means that we can face it all together. We can just pitch in and do what we have to do, and it doesn't mean some kind of chaos will ensue. We're hoping that if there's a plan, there's a will, there's a way. So also, we haven't been depending a ton on volunteers. We do depend somewhat on volunteers for our administrative work, especially some data entry in our My Turn software for equipment. And we have a incoming volunteer librarian that I'm really hope. I've tried a couple of times to get a volunteer librarian to help us with our software, and we're I think there's one incoming right now, but we bought the software in January. We got it for half price from the developer. I think we paid $200 for the year, and they're going to try to re-up us at that rate. And that has given me sort of permission to just go slow, just chip away at what we can do to make things better and get better metrics and get people online. So half of our customer base is actually accessing our website from their cell phone. And that tells me that they're capable. It isn't just people over 65 that don't know how to use a computer or a cell phone or some other kind of software. It's also people that are perfectly savvy and can look online. And I especially want to help the Fire Cares team and Jefferson Healthcare see what we have on our floor without having to come down to the shop. So I think it's going to be a precious tool for people to be able to see, and we could even potentially, I think it might be even less expensive administratively to have a little webcam in our equipment, but I'm not sure we can do that with HIPAA. I'm not certain we can actually have a live webcam. Maybe we can just have it on the equipment itself, on one wall of equipment or something with that. I don't know. It's just something I'm thinking about. I love to figure out ways of making it easier for the public to access ECHHO. Because even though we've served approximately 10,000 people since we opened in 1997, so it's almost about the population of Port Townsend. We've served like every single person. It feels like a lot of people have no idea who we are or what we do. And so I've been out on Nextdoor quite a bit trying to, God, are there any questions? I've been rattling on without even looking at the board. Okay, no question.
I'm so sorry to interrupt. I actually was just trying to find the raise my hand question
Aiden.
here.
Yeah,
Yeah.
go.
So I was wondering, because it sounds like, if I'm understanding correctly, that you're trying to think about sustainability and systems development
Yes, ma'am.
for that DME program.
Yes, ma'am.
Have you tapped into the technical assistance and consultation services from Washington Assistive Technology Program? WATAP?
Yeah. Well, are they with WashDOT?
No, these are this is actually a service that's out. It's based out of University of Washington. Let me put the link for their technical assistance
Thank you.
program into the
That's
chat.
wonderful. I did explore an accessibility entire program last year
Mhm.
and went onto our website to see, are we doing anything to make the website more accessible? And I've not gotten that far, aside from things like trying to make sure that our printed materials are large type and making sure that the pictures have captions that describe the picture and things like that. I couldn't figure out quite how to create more accessibility, but I just was talking with the accessibility advisory board of Jefferson Public Health yesterday, and I think that might be something that they can help me with. Since they're right here in Port Townsend, I can just go over to their office, or I can just email my new
Right.
buddies over there now, and they can tell me, hey, here's a great link for things that you could do for the website. And I kind of went through the website like with a fine-tooth comb, thinking like, how do I do this? And it wasn't necessarily intuitive or user friendly to figure all that out.
It's not.
No.
So
Thanks for the
what
link.
you're
I'd
talking about
love
is
to.
actually a different thing.
Oh,
And I only know about this, both of these resources, because I worked for Division of Oak Rehab for 5 years. So the WATAP is actually their main purpose is they're a equipment and like support devices lending library for the whole state. They also do technical consultation, which is the one that I linked into the chat. So like they actually help folks with programs like yours kind of expand a little bit and give kind of a roadmap for that.
fantastic.
Yeah. So
Creating? That's a
I've not
different,
used that service. I've used their durable medical equipment lending program a bunch,
okay.
but they were phenomenal to work with. They were super super nice, and they were really willing to answer a lot of questions.
I can't wait
Um,
to get in. Thank you. I was going on a different track of
no,
accessibility.
but I have a
Thank
thing
you.
for that too.
Yeah.
So the second link is there is called it's W3C, the Web Accessibility Initiative.
Okay.
So they actually have um some fairly easy to use tools because like I'm not a programmer, I'm not a web developer, so
Yeah.
I don't really want to try and figure out the coding part of those things.
Yeah.
But there's some common sense guidance. They have again people that you can ask for some technical support around that. And I know they've been really helpful in a few different programs that are in my area, which is Whatcom County.
Okay.
So first one is DME, second one is website stuff.
Okay. That's awesome. I cannot wait. Hey, do we get this little transcript from you, Yvonne, at the end of the day?
Do not, but I can just copy and paste it and email it
Yeah,
over to you, Kit.
I'm not doing any of that right now. I'm not doing any
I can
note
I
taking
can send
at
that
this
over to
moment.
you.
Yeah. Thank you.
Sorry to interrupt your flow. It was just
No, no, I'm in
I
my
heard you
garage.
talking and I'm like, I think I actually know the thing that might help.
You do, you do. I can't wait to open that up. Yeah, I'm in my garage. I just zoomed over here to Zoom because I can't Zoom at work because my work computer doesn't allow my headphone to, it disconnects my headphone completely if I go to Zoom, and then I have to readjust my entire computer before I go back onto my headset for phone calls. So I
Yep.
come home for, excuse me, the long explanation. I'm in my garage, so I'm not prepared to take notes.
No, all good. My computer does that as well. I've tried updating every piece of firmware and software that I can. No dice.
I
So
used to
I
be
get
the
it.
IT person. Like in every place I've ever been, any kind of admin, I was always the IT the go-to IT person. Now I'm like helpless sometimes. So I'm just like, what?
I'm
Can't do
curious, Kit, if you could share a little bit more about how to like
that.
access. So I know you talked about like sharing and wanting people to know how to like get services. I'm curious like what that process looks like. Is there an intake that's taken
Yeah.
place? Do they call you? Like I'm just curious if you could share what that looks like.
So for equipment, there's really no you don't become a client of equipment. Anybody can walk in the door. There's no eligibility at all. It's just anybody at all that has an issue that they need to solve with a piece of equipment. But if you
Would they
want to
call you
buy,
or go to your site?
you can go, well, you can go to the website and just read about our services, or you can come into the shop. So at Washington Street, 2326 Washington, down by the water. Um, but for rides, it's different. Rides is a different whole thing, and you need to be eligible for that. Eligibility is somewhat flexible in terms of, it isn't just very low income, disabled, uh, rural customers. It's also people that may have a temporary disability due to either an injury or cancer or dialysis or whatever it is that's exhausting. It might be exhausting and they just cannot drive themselves. Also, anesthesia, vision surgery, anything that makes it so that they can't drive their own car, which they normally would. Um, the state allows that, and of course, Petra knows that they allow that with O3A, which is one of our biggest funders for transportation. Of course, we get reimbursed for mileage by O3A, and we share that mileage with our drivers, with our volunteer drivers. So almost all of our drivers get a small reimbursement, and then we get that as well for our operating costs. But our operating costs for transportation are incredibly low. Um, actually, really, it's the equipment that takes a lot of our space and uh, a lot of work. Transportation is so automated now that we have assisted ride software, which we've had for, I think, 3 years now. Um, it was before I came on board, but assisted rides is incredible. Transportation software. It just allows all the 46 drivers we have to sign up online. We don't even see these people. I mean, it's just amazing. I mean, I'm starting to have more annual events so that I can actually see their faces and say hello and say thank you and give hugs and stuff like that. I mean, it's really important. And we just planned a driver event down at Finn River November 6th, and we have 15 people coming, and in fact even some staff members want to go. So it's just, it's wonderful, and I can't wait to do more of it. One of our drivers suggested we do it quarterly because they could really use that support. They don't see anybody, they don't get any atta girl and atta boys, and everyone needs that, and they do such amazing work. It's certainly fulfilling in and of itself to be a driver, but to have your organization that you're working for kind of say you're amazing is extremely important to hear. So
That's
yeah.
super helpful to hear. I'm also curious, when it comes to like costs, is this something like with both programs, so with medical equipment and then with transportation, like is it billed to insurances or what does that look like?
Absolutely no cost at all to
Oh,
anybody.
cool.
Yeah. And we rely on donations, obviously. About half of our entire income base is from private donations. And the majority of that is from equipment users who come in and donate when they get equipment. That's, amazing. That's the community of Port Townsend basically keeping our doors open. It's fantastic. And so between O3A and WashDOT and the Department of Transportation and Jefferson Healthcare, those are our, and also Jefferson Gives. Jefferson Community Foundation is a tremendous source of giving for us, or of donation for us, because Port Townsenders who don't really know, like, well, where am I going to put it? Where I want to give, but I don't know where to put it. There's so many priorities. What do we do? We just give it to the Jefferson Community Foundation, and they make that allocation, and it just is such an amazing service for us. So we actually were eligible again this year, which we didn't think we were because they've changed their criteria. And we were able to get our grant again that we've been depending on for years and years. And thank goodness, so yeah, I'm actually going after many different funding sources that we've tapped into in the past at some point or other, but are going to try again at different, we're all going to have to do a lot of fundraising that we weren't doing, for a while. So yeah. Anything else? Any other questions I can answer?
I have one other question. I'm so sorry.
No, please.
So another thing that I was thinking about, because you mentioned kind of like cost sharing and looking at spaces and partnerships within the community. Are you guys partnered up with Jeffco Repair at all?
I don't think we are, and I don't think I even know what that is. Can you tell me better what that
I totally can.
what it
So,
is?
I found it when I was searching based off of a program again in Whatcom County. We have like a maker space where there's community building and a repair program for small household appliances started out of that. It's
Yeah.
now paired up with the library and our local mall of all places. But through that, I found this program, which is similar in Jefferson County. So, Jeffco is a program developed by PTMSC and
Oh,
local
the
collaborators.
Marine Science Center. Yes, we are hooked up with them. Yes.
Okay, good. Because I'm
Yes.
like, this is the closest thing I could see being kind of a natural partnership because they
Yeah,
might be able
yeah.
to help with repair
Well,
services. They might have space, they might not.
yeah. It's interesting. I have approached the Quimper Grange, who hosts the Marine Science Center, for those repair events. I don't know how the Marine Science Center got invested in a repair event. I have no idea what that it means. But anyway, um, I have approached them about a collaboration where we have a yearly giveaway of equipment that they might be willing to repair. Some of that has kind of changed for me because it seemed like a stretch of a fit, and then
Mhm.
we got this amazing equipment coordinator who literally looks at something and it puts itself together. He just
Yeah.
repairs everything instantly, and then we were getting kind of just a better bunch of equipment. We're turning down some donations, which is a little spooky for me because we've been a clearinghouse that people appreciate. I don't have to go to the dump and I don't have to go to metal
Right.
recycling. I can bring it to ECHO. And
Mhm.
ECHO's been this huge house that we could just shove things in the basement, and we can't do that anymore. So we're turning things down as politely and kindly and lovingly as we can. Um, doesn't always make people happy not to be able to dump something off, but
Yeah.
it means that our equipment is in better shape than ever before, and it means that we have a smaller inventory of better equipment, and that is very good for the community, even if it costs us a little bit.
Yeah.
So, yeah, it's a good one. Aiden, I don't know how we will work with them in the future, but I did initiate that contact early this year and say, can we please get together and figure something out? I also approached the tool library to see if they wanted to get
Nice.
together and figure something out somehow. And they used my turn. The new equipment, the new repair tool library uses my turn. And I asked the kids the children who started that program, fantastic young people that are just so on top of everything. And they sent us this beautiful little how-to, a little written how-to, how to kind of be careful about how we staged our input into that software so that it was most effective. So yeah, I did collaborate with another library, and I also actually the Ballard Tool Library. We have friends that are running the tool library. I have friends that are running the Ballard Tool Library, and they are also considering coming over and giving us a day of their time and just seeing what we're doing and how to do it better. So yeah, I've been trying to reach out. I love your ideas, and please, I hope my email is out there for everybody. Should I put it in the chat or something? Should I put my email?
Right.
Yeah, I should. All right.
Sorry, I realized I was talking and I muted myself. Sure. Kit, that's a great idea.
All right.
And then Aiden, if you want to throw yours in there as well. Kit, I started a email for you where I copied all of the links that Aiden shared. So I'll get that over. But Aiden, if you want to share your email, then I can also just um, do like a warm handoff to you and Kit, so you all
Cool.
can keep the conversation
Thank you,
going.
Saden. Okay, thank you, Yvonne. Fantastic. Great.
And
So,
thank you for being kind about like the suggestions because Jefferson County is an area that I serve less frequently than places that are closer to me, but still plenty. I was like, well, these are the things I'm aware of. I stumble onto most of them as a result of a rabbit hole of 12 click
me
throughs
too.
to different websites.
Yeah,
So
me
like
too.
maybe this is super well known, maybe it is totally not. So thank you
Fantastic.
for answering my questions
Oh,
and not being like,
I'm delighted to hear because I didn't know what the Jefferson Repair,
yeah.
Coalition. Why did I don't think about names very much, but yes,
It,
and
it's hard to store that kind of information.
yeah,
Like I have a very carefully curated Chrome bookmarks tree that has all the different file folders with topics and stuff like that to sort it. So otherwise I'd be lost.
I also can't. Yeah, like I said, I can't figure out how the Marine Science Center got into the repair business, but
I
I
don't
love
know.
that they did.
There's a similar one up here in Whatcom County where it's like it's run by the port and they
Yeah,
do all sorts of like community education, some
yeah,
of which has absolutely nothing to do with
yeah.
anything marine. So I don't know. Whale biologists are weird and awesome. That's all I got.
Yeah, the port is actually a stop that I'd like to make at some point and say in terms because the port is very much about sustainability. As you
Yeah.
all know, they've just bought Shorts Farm recently. It's like, well,
Oh, I didn't
they're
know
about
that.
sustainability. So I'm interested to know. I mean, we have to stay local to Port Townsend City because we have to. There's
Yeah.
our entire client base is here. excuse me, not our entire client base, but the majority of our client base is in
Yeah.
Port Townsend itself. And I just wonder if there's something that the port or I don't know, the Northwest Maritime Center, I don't know who might be interested in figuring out some space with us, because people have space, but they don't know we need it. And
Yeah.
we have a 3-year lease. And at some point, I'd love to hear from anybody about where to go in order to either have a very low interest purchase, long-term low interest purchase of a piece of property, or a very low 30-year rent contract, something like that. Something from somebody who wants to be generous to a place that needs to maybe even expand a little bit. Expanding our equipment could look absolutely amazing. There's a sister community down in Bremerton called KC Helps. It's the Knights of
Knights of
Columbus.
Columbus.
Yeah.
Yeah.
And Bill, I want to call him Bill. We've been texting off and
Remember
on. I
name.
should
I'm
know
so
his name.
sorry.
We text anyway. He has this incredible organization, and they're looking for a place to go because the St. Vincent de Paul that owns the entire block where they are is turning it
Mhm.
into affordable housing, and he
Oh,
has to move this giant
okay.
location. And I'm realizing when I look at his place, because I went down there to visit him, and they have literally everything there. They don't turn down any donation of anything perimedical,
Nice.
anything,
Okay.
like every possible ace bandage and anything, and we don't take stuff that we can't clean. We don't take stuff that's going to take up space. We really have to be careful.
Right.
And I would love to be a clearinghouse for diaper. We've taken some diapers. We're going to have to be careful about that. They're all wrapped up and not, sealed and everything, but we could end up with a flood of those. So I have to be kind of careful at what I take in, but I would love to be able to have a little shelf for people that need, incontinence supplies or
Yeah.
anything. I just want to be able to provide it because it's all free because people are letting it go. They don't need it anymore,
Yeah.
or sadly someone has passed on, or who knows what the reason is,
Oh,
but
yeah.
we could actually provide Port Townsend with a lot more if we had more space. And I think that might be a really spectacular thing. They haven't seen it yet, but I'm kind of hoping we can create it. The Mercantile is somebody else that I've been thinking about. They're going over into the Evans Vista space. As you all know, they found a new place to build the Mercantile out at the first roundabout. And it's just occurred to me, like, maybe I could talk to the Mercantile, since it's a community organization, it's a cooperative. Maybe I could talk about a little collaboration of some kind. It sounds far-fetched, but you never know.
No, I mean, sometimes the weirdest things come together and actually work out.
Yeah.
So, like for one, your idea about the port is fantastic because I know in several counties, the ports own a wild array of properties and end up being
Yeah,
leaseholders.
that's right.
Um, but the other thing, and again, I don't know why this was something that came about in DVR anymore, but let's see, I'm gonna have to do this in two stretches. There's an auction site, several from the US government, where, especially since they're doing a lot of downsizing or not renewing leases for things, you can find like office buildings and warehouses and stuff like that for ridiculously cheaper than you're going to find
Well,
elsewhere.
especially in Bremerton or someplace, not in Port Townsend so much, but yes, you're absolutely right. And if the port picks them up, we can negotiate, yeah.
Yeah.
Yeah. It's all something I'm just dreaming about. Yes, Brett.
Hey, Kat, just for your info on the Clipper question, you happen to know the chairman or chairperson of the board.
Oh, I do.
My boss,
Oh,
Deborah Stinson.
indeed.
Yep.
This is another wonderful connection we get to have with
And and
you.
she loves ECHHO.
Wow. Nice. Okay, well, that's a great intro. Thank you, Brett.
Any other questions from the group. We've got Sarah, Petra, Jacob, Ka. Any questions about ECHO?
Well, thank you, everybody. I really enjoyed talking to you. I just talked my head off. Didn't love to hear from you guys if you have any thoughts or comments. I'm always open to input. You can email me and just say, hey, I had an idea. So
I'm gonna take the silence as their questions were answered, which is great.
okay.
Aiden thinks they've taken up too much airtime. I don't think that's true. It
Great.
seems like there's going to be a beautiful connection between you and Kit. So I've got an email already drafted and I've copied and pasted everything you shared. So I think that's great. It seems like, yeah, Sarah said this has been informative. So I think this is super helpful. Kit, I just want to thank you for your time. Like, I love that I got to learn more about ECHO. I've heard nothing but amazing things from our Jefferson partners. And so it was really nice to get like a better understanding of like how to connect to the services and like what specifically they were. But it's just so great to see like how collaborative you are and how open you are to just like supporting this community. So I really appreciate you like taking the time to chat with our folks. Like I mentioned, this is recorded, so I'll go ahead and I'm going to stop recording actually. So give me